This presentation discusses issues children of physical abuse may face and ways parents and professionals can address them. According to the Abstract Handbook on Maltreatment, 3rd edition, physical abuse is defined as a non-accidental physical injury inflicted upon a child. Physical abuse can include, but is not limited to, hitting, beating, kicking, or shaking. Children that have been physically abused can display a myriad of internalized and externalized behaviors. Gill identified several traits regularly observed by professionals treating abused children. Internalized behaviors include anxieties and phobias, perhaps due to a constant anticipation of danger, sleeping disorders, such as night terrors, eating disorders, and arguably the most serious signs, depression and suicidal gestures. External behaviors, those behaviors directed towards others, can include aggressiveness, hostility, destructiveness, and violence. Though these traits are common, parents should be pleased to know they do not exhibit themselves in every child that has experienced physical abuse. There are some mitigating factors that can determine the level of impact abuse has on the child. Some aspects to consider are the child's age at the time they were abused, the chronicity or the period of time the abuse lasted, and how severe the abuse was. Additionally, the relationship to the offender can play a major role in how the child responds. Children abused outside the home have the option to isolate the threat to an external source. They can then look within their own family and to people close to them to be a source of comfort and support. If the abuse takes place inside the home, the trauma is more extensive. A child may now begin to fear that the people who love them will also hurt them. Lastly, we must consider the child's mental and emotional health, feelings of guilt, the sex of the victim, and how the parents respond to the child. If the child is already suffering from psychological problems, it may change the way they view the abuse and the guilt they feel afterwards. Parents can be integral in the recovery process by believing the child's report of abuse, being positive and reassuring. Child therapy is a relationship between a child and therapist with the goal of resolving symptoms of abuse and facilitating stability within the child and their environment. Children traumatized by abuse could benefit from creative arts therapy, also referred to as expressive therapy. Some creative approaches used by practitioners are art, music, drama, and play therapy. Art therapy utilizes visual materials in counseling, intervention, and rehabilitation. Children get to use crayons and markers, paint and paintbrushes, paper and poster board. Therapists also incorporate fabrics, yarn, colored paper, and even clay into their art sessions. The use of music has been proven to be effective in exacting positive changes in children's cognitive, physical, psychological, and social functioning. In terms of symptom relief, trauma therapy is very beneficial. The victim gets to take an active approach in telling his or her own story,
as it relates to the abuse. This brings about physical and emotional integration, resulting in personal growth. Play therapy must be administered by trained play therapists. Much like art therapy, this type of therapy creatively uses items to help in the counseling process. Some common play objects are board games, building blocks, and puppets. Puppets are good for role play. It allows the victim to express themselves while maintaining a sense of separation from the traumatizing event. Prevention should be a major focus in educating our children about abuse. We can teach our children how to say no, to run away and get help, and to tell a trusted adult what happened. It is also good to educate kids that they have power. They have power to use their words, power to keep or share thoughts, power to keep or share their feelings, and power to keep or share secrets. Children can use the abilities they all share: the ability to think, decide, choose, act, talk, and tell. Focusing on their powers and abilities can help eliminate unhealthy feelings of vulnerability and low self-esteem.